Following segment is sponsored by Oakview Medical Associates.
Some women and men will wait until the age lines in their faces are deeply set, but then they seek out aesthetic treatments. But Dr. Anita Bajor is here from Oakview Medical Associates to say, really, the earlier, the better on all this, isn't it, Dr. Anita? Hi.
Yeah, hi, how are you?
Good. It's good to see you. We live in a time when these aesthetic treatments have come a long way, and there are a lot of really safe doctor-assisted options. People are even proud to maintain their youth. Are attitudes changing?
Yes, I've seen that, and it's been a real shift. I mean, years ago, it used to be where nobody would talk about cosmetic surgery and the mini facelift they've had, but now thoughts are changing, attitudes are changing. It's a sign of you taking better care of your health. And so people are getting procedures done, and they're, educating others, talking about it, and getting great results.
And years ago, you would have thought it was wild if somebody, in their young 30s was doing stuff, but really people are starting their treatments earlier. Men are also coming in for this maintenance as well. Is that part of the trend you're seeing?
Oh, yes. I'm seeing a lot of men nowadays that are paying attention to their health. It adds to their confidence, and people are being proactive. They're looking at signs of aging and catching it early and coming in and having that discussion with us. The technology is so good nowadays that you can really have a good treatment plan for yourself. And that's what I focus on, really knowing the best technology out there and what are the different options for you.
And it certainly isn't about chasing perfection either. It's about the way a person feels when they look in the mirror, or specifically what might be bothering them. What are some signs of aging that are most treatable?
So the most common one we all notice are the lines on our face, the texture of our skin. So for example, the forehead lines that we see, that can be dramatically softened and improved with some simple tools like botulinum. Those are little tiny injections of a substance that we can inject, and it softens the muscle underneath the skin, and so the lines relax. And people get great results. And the good thing is it's not permanent, it's temporary, lasts 8 to 12 weeks, has no downtime, and you can really have that confidence and go on with other things in your life. Likewise, we have the number 11s that we can do things about. Similarly, we have crow's feet areas here that we can treat and soften. Lips, if you think your lips don't have that fullness, we can actually fill the lips with lip filler, which are very good instant results, and they last for a good 6 to 12 months. We also have the pre-jowls, marionette lines, the neck sagging. That also, botulinum is indicated for neck bands. So great results nowadays that we can really tap into, and people are paying attention to that. They know that they can get great results with this.
A sign they're taking care of themselves. Yes. I like that. And people come in and they see you again after these treatments, and they just tell you that they feel so much better. What are you hearing from people now?
Well, I'm really hearing that, oh, I should have done this earlier. Yep. That's one of the most common things I hear. And so some of our younger patients are almost doing it preventively because they can see the lines. If their parent has strong lines, we call it baby botulinum. So we're getting tiny amounts every, maybe even once a year, just to keep it softened. And people are getting more confident. They're recognizing that this is part of their self-care. And that's health. Yep. These injections are not, they're not just spa, they're medical treatments. They're done by professionals. We are board certified. We know the anatomy of the face. So you must find somebody that's absolutely trained in this and knows and is knowledgeable, because then we can get you great results. So.
Yep. And this is just part of your practice. You do a lot at Oakview Medical Associates. What do you want us to know about your practice?
Yeah, so our practice is a family practice, which is primary care. So we're your first point of contact for your health. Whether you think you need to see a specialist or you have chest pain, shortness of breath, we want you to come to us first so that we can evaluate you, assess you, give you the best treatment options for your condition, and then get you back into a wellness mind frame, so that we can identify any illness and sickness and then point you in the right direction. We also do physicals for children, adults. We focus on Medicare wellness exams. There's a lot that we do, but we do it really well, and one patient at a time. We're very personalized in our approach.
Yep.
So.
And people love that one-on-one attention that they get from you. Oakview Medical Associates is located at 115 Works Plaza Court in Simpsonville. The number 627-0444. Dr. Anita Bajor from Oakview Medical, thanks for the conversation.
Thank you.